My name is Yesenia Romero. I'm a nursing student with Harper College, and I'm going to be doing a case study on a patient who's 73 years old. She's a female. She's diabetic. She has a history of AFib. She was at the grocery store reaching for some toilet paper. She fell. She hurt her left forearm as she was falling on one of the shelves. She also hit her head on the ground. We call it a deceleration injury of the head. The husband was with her. He said there was no loss of consciousness in her level of consciousness right after the fall. She's now here at the hospital with a subdural hematoma and also a laceration to the left forearm. So I will go ahead and go inside and do my nursing assessment. Hi, can I come in?
Yes.
Hi, my name is Yesenia Romero. I'm a nursing student with Harper College, and I'm going to be doing a neurological assessment of you. I'm going to be your nurse today. Can you tell me what is your name and your date of birth?
Catherine Romero.
Okay, and what's your age or your date of birth?
73.
73? Okay, Catherine, and where are you at?
Hospital.
At the hospital, and can you tell me what the date is today?
November 15th, 2020.
And who's the President of the United States?
Trump. About to be Joe Biden.
Okay, very good. Okay, and then can you tell me, I read your chart, and I got report from the other staff as well, but can you tell me briefly how you ended up here?
Yeah, I was at the store around 3 o'clock was when I fell, and I hit my head, so now my arm and my head are pain.
Okay, I see. How bad is the pain?
4.
Okay.
Yeah.
So the headache is, so for it, you wouldn't say it's the worst headache of your life, or you would?
No.
No? Okay. All right. So I'm going to assess, I'm looking at your airway, your breathing, and I want to assess your circulation. Can I look at your arms?
Yeah, you can buy doors, build stuff, buy perks, buy guns, still. It's a classic gun.
Okay, I see your capillary refill is less than 3 seconds. Can you squeeze my fingers?
Yep.
Okay. My hands, can you push?
No.
Can you pull? Okay. Okay. So move your fingers. Okay. All right. So what I noticed with your airway, breathing, and circulation, your airway is open, is patent. Your breathing is regular breathing rhythm. I can see your chest rising completely and going down completely. It's even. And then with your circulation, your color is appropriate for your ethnicity. It feels warm to touch. Your pulses are strong. Capillary refill is less than 3 seconds. Pulses are also symmetrical, which is another thing I'm looking for. The other thing that I assessed really quick also was your Glasgow Coma scale. This is something we assess on all patients that are here for a head injury. Pretty standard. What it is your eyes. They open spontaneously when I walked in. Verbally, you're orientated times 3. You know where you are, you know your name, you know the date today, and you know the situation, what's going on around you. And then the other thing that I assessed was, your motor, were you able to follow commands? So you were when you were able to squeeze my fingers, okay? So what I'm going to do really quick is I'm going to continue your assessment. I'm going to feel your legs, okay, with the back of my hands. Okay, they're warm, they're dry. Circulation. Less than 3 seconds. Very good. Very good, very good. Okay, your pulses. Symmetrical. 2+. Okay. Can you push up? There you go. Push down. Wiggle your toes for me. Okay, close your eyes. Tell me where you feel this.
Left arm. Left hand. Left leg. Right hand. Right leg. Left leg bottom. Left leg bottom. Right leg bottom. Right leg top. Right leg. Right leg.
Okay, very good. So that tells me your sensation is intact, and also your mobility too is intact. And I also did your Babinski reflex, which is negative, which sometimes we also check it with subdural hematoma, and we want it to stay negative. That's a good thing. Okay, so What normally I would listen to on a full assessment is also your heart and your lung sounds and your abdominal sounds, okay? So I'll go ahead and I'll listen to that. I will listen to your apical pulse for like a full minute, and I will listen under your clothes, but because it's a YouTube video, we're gonna go ahead for respect and do it in privacy. We'll do it over. I will listen for a full minute. Ask you to take full deep breaths. And again, I will listen under the gown, okay? And then listen here. And I want to make sure that the lung sounds are clear. And then also, probably when changing or something, I would listen to the back of your, I don't want to move your head too much because of the subdural hematoma. So when we change you, I would take a look, listen to the back of your legs, okay, your lungs. Also, I will listen to your abdomens. I want to make sure that you're positive on all 4 quadrants. Any pain, any problems with your abdomen? Are you able to pass gas?
Yes.
Yes. Okay, very good. Okay, since it's more of a neurological screening assessment, I'm not going to go ahead and listen, but normally I would. So, did your legs, did the glass glucose, oh, I didn't talk about vital signs. Your vital signs, I want to check them every 15 minutes. Things that I'm looking for, if your blood pressure drops, you go into hypotension, then that means that that's a sign to me that you might be bleeding out even more. If you're going to bradycardia, means your heart is going slower. That's another indication that I'm looking for. I'm looking for any breathing problems. I'm also looking for any change in temperature. So breathing problems, change in temperature, that tells me that your body is not able to auto-regulate as well, which is a complication of a subdural hematoma. In the medical field, we look at Cushing syndrome, which is the Cushing triad, is what we call it. So what we're looking for, it could be hypertensive, or it could be like between your top, in your blood pressure, there's a top number and a bottom number, right? We call it systolic, diastolic. So the bigger the gap, we're looking to see if the gap widens. We're looking along with that to see any irregular breathing problems and if your heart rate is slowing down. That's our triad sign, typical, that warns us something's going on, okay? So this is why it's important that we check every 15 minutes. Neurological. I gotta finish my neurological test, but we're gonna be doing it every hour. Okay, I'm gonna come in here and do it every hour. Reason we do it so often, your vital signs, your neurological checks, is because you hit your head. You have a subdural hematoma. That subdural means it's below your skull. Below your skull, there's a we call it dura mater. So it's a hard piece of matter. Right below, right there is where your veins are. That's where the bleeding is going on, okay? So subdural hematoma means that the veins were affected. And the veins, they tend to bleed out slowly because they're smaller. So they're smaller than arteries. So they tend to bleed out more slowly. So you could have symptoms, not now, but you could have symptoms 2 days from now. Or they could gradually start to show, if that makes sense. So that's why we do it every hour, so we can catch them and act right away, okay? So I'm going to go ahead and I'm going to finish with the neurological assessment, okay? So what I'm going to do is I'm going to check your pupil size. I want to make sure that it's equal on both sides, okay? A 4 and a 4. And I'm going to have you close one of your eyes or cover. Yeah. And I'm going to shine a light. Okay. Same thing, other eye. Shine a light. Okay. And I was able to see them constrict. Follow with your eyes, not your head, okay? Okay, so it says Perla. Your pupils are equal, round, reactive to light and accommodation. Okay, that's perfect. So right now, okay, so your Glasgow Coma scale is at 15. Your vital signs are looking good. Your neurological assessment that I just did is looking good. So what I'm looking for are any acute changes, minor, minute changes, other things that I want to look at. I want to assess, do you have any nausea right now? Vomiting, Diarrhea. Okay, your headache is at a 4. If it increases or worsens even slightly, I want you to let me know, okay? Do you feel confused or irritable? Okay.
A little bit.
A little bit
Yeah.
irritable or confused?
Irritable.
Irritable? On a scale of 1 to 10, how irritable would you say you feel? A 3 right now? Okay. Alright, thank you for telling me. So I'll continue to check in on that, with you on that, okay? Other things that I'm looking for is I'm going to look at your labs, okay? I'm assuming they already did a CT scan, and I can confirm by looking at your medical record, but that's how they would have come up with subdural hematoma. It's not uncommon that they might ask for another CT scan. The reason for that is we want to assess, is everything looking the same? Is it looking better? Is it looking worse? Okay, so it's not uncommon to have another one done. You might also get an MRI done, which it's like a CT scan, but it takes longer, but it's more, it gives us a better view of what's going on. Now with that, we would have to make sure you're not wearing any jewelry, nothing that's metal. And I want to ask you right now, since you're here, do you have a pacemaker? No? Okay. So that's another thing that we would have to look into if you had a pacemaker. And then the other thing, labs. As far as labs, I want to see your CBC. Okay? CBC, I'm looking for your white blood cell count. Okay? Any increase would indicate to me an infection, which that is of concern to me because of the bleeding, but also because of the bruising here, or because of your laceration here. Which reminds me, I want to check your laceration. When I'm looking at it, I'm looking for redness, I'm looking for edema, I'm looking for edema basically means swelling, ecchymosis, which is bruising, also any drainage, and any in the approximation, which means that I want to make sure that it's closing, it's healing appropriately, okay? There's no uneven or roughish to it. And right now what I anticipate the doctor would do is he would probably order like an antiseptic and some dressing to cover it. And also we will continue to monitor it. Okay, so with that said, I'm looking at your CBC at the white blood cell count. I'm looking at the platelet count, see if it's dropping. I'm looking at hematocrit and hemoglobin. Because a lot of times it'll show anemia before anemia will indicate to me increased bleeding in your subdural hematoma area, where neurological signs can take actually longer than the anemia to show up. So if it makes sense, like if I keep a look at your lab values, they might give me something that's going on before the neurological test. Okay, so that's what I'm looking for. Your CMP, electrolyte levels, very important. I need to see if your glucose is dropping. I need to see if your hyponatremia, your salt levels are dropping, if your potassium is higher, which sometimes these are things that we see. And it's very important because the doctor's going to probably put you either on a normal saline or on a hypertonic saline solution to get everything regulated and drain the blood from your hematoma site, okay? And he's probably also going to order something like mannitol, which is it's a diuretic that'll help drain everything out. And with that, we need to assess your intake and your output, and make sure you're urinating at least 30 milliliters an hour. Other things that we're going to do is PT-INR, very important, because you have AFib. I need to assess your PT-INR levels, which PT-INR levels, they mean you're bleeding. So you're probably taking Coumadin or warfarin or something for AFib. We want to stop that right away. We don't want to increase your chances of bleeding out. And we also want to assess that your PT-INR levels are within a therapeutic range. Okay? So that other things that worry me as far as lab values, CBC, CMP, PT-INR level, your ABGs. I want to look at your gas levels, because what I'm looking for is to see if your carbon dioxide is it can be low or it can be increased with subdural hematomas. which that tells me there's a problem going on with your breathing, which is a big deal. Okay, so I'm gonna look at your arterial blood gases. And the other thing that worries me is the risk of stroke, because you are diabetic, you are at an increased rate for stroke, you are in the hospital, you're not really moving. We want you to be, which we don't want you to move. How you're seated is perfectly. We want your head to be midline, and we want you to be at a 30 to 45 degree angle. So how you're laying down right now is perfect. But at the same time, because we want to drain that blood from your head, so the 30 to 45 degree angle is perfect. But at the same time, it worries me. It puts you at risk for stroke. So that's why we're going to put on you some compression devices to help move the blood within your legs. Also, I want you to do range of motion movements in all of your joints, okay? Your hand joints, your feet joints. And I'll come in and I'll remind you every hour as I do my neurological checks. I'll come in, we can do some of them together, okay? But we want to get those joints moving. Remember to move them as much as possible. I'm going to give you an intensive spirometer. I'll show you how to use it. This is something that we're going to use for the lungs. It's something that we want to give to all patients in the hospital when they're laying down like this too, because we don't want problems in the lungs with like pneumonia or something like this, okay? So those are more like prophylaxis, like preventative treatments that we want to do. But we really want to do them because it could prevent something serious from happening. Another thing that we want to do, so as far as medications, we're probably going to put you on, like I said, hypertonic fluids or isotonic fluids, mannitol, and there's a calcium channel blocker that the doctor might put you on to help drain that fluid. And also, we want to put you probably, my guess, so we're going to stop warfarin, Coumadin, whatever blood thinner you're on, we're going to stop. And my guess is the doctor's probably going to put you on a seizure precaution medication like Dilantin, something like this, because there's always a risk for seizures whenever there's head injury, especially if your electrolytes are off balance. There's always a risk, so my guess is they're probably going to put you on that. And I know we went through a lot of information. When you discharge, we'll follow through again. We'll look at an overview of why you're here, what to look out for when you go home, when to call the doctor, what medications to continue to take, what not to take. Also, I'll give you a printout, and in that printout, I'm also going to provide referrals to different websites that you can access to get additional information, okay? I'm sorry it's a lot. We'll continue to go over this in little bits and little bits. Do you have any questions for me right now? I know it's a lot. You might not have a question, maybe later when I come in, but I'll come in often, 1 hour to do your checks, so lots of opportunities to ask questions or clarify. The biggest thing I want to tell you, when you go home, if you have any symptoms of all of a sudden nausea, vomiting, headache, or your headache starts to worsen slightly, your irritability, you notice you're a little more irritable, or all of a sudden you start feeling confused, forgetful, right away give us a call, okay? Because that could be something going on. Don't ever feel silly about giving us a call, because it's very important, okay? It's your health and it's very serious. A subdural hematoma, bleeding in your brain, is very serious, and it could even be lethal, which means you could even die from it. And especially with the subdural hematomas, when we discharge you, you might be okay, but then a few days later, you might start to feel that nausea and that vomiting. So it's be your own advocate and go ahead, give us a call, come to the ER, call 911, okay? So that's all I have to say. And I'll see you in about an hour. How's that?
All right.
Okay, thank you.